Hello and welcome back. I am Ashok Rajguru, your tutor, and in this video we will see how the case was managed and how the treatment evolved. The objectives of this video are: the first follow-up after the patient was prescribed opium in 1 potency by Dr. Jaswant Patil. What was the remedy that was used to follow that to complete the cure? What were the possible justifications for choosing the remedy that followed? And then we will have a look at the radiologist's report, which shows that the cure was indeed complete and not just a relief from the physical symptoms that the patient was presenting. So first, the follow-up. Dr. Patil says that based on her symptoms, she was given opium in 1 potency. After a few follow-ups, she was better. Her difficulty in speech improved. She could walk better. After that, Dr. Patil says that he selected a second remedy. To quote Dr. Patil, after reconsidering the symptoms, she was given plumbum metallicum 30. He does not discuss what were those symptoms that he reconsidered. So let us see what could have been the reasons justifying the selection of plumbum metallicum. Her vomiting was better. And the final comment that Dr. Patil gives on his website is, thus homeopathy was superb and dynamic in this case. The patient and her family were very much happy and satisfied with homeopathic treatment. Let's take a look at plumbum metallicum. Although Dr. Patil does not give us any further information, and he summarizes it by saying that after reconsidering her symptoms, but we can always look up references that justify plumbum metallicum, and that's what we shall do over the next few slides. One good place in any case is to go to Bonninghausen's concordances. If you have any homeopathic software, it is bound to have the Bonninghausen repertory, and you can just look up the concordances. Concordances are also known as associations or relationships between remedies. Here is a snapshot from Complete Repertory 2014 edition, and the association that is shown between plumbum metallicum and opium is at grade 4. The other remedies that turn up in grade 4 are, of course, Belladonna bryonia, Nux vomica, Lycopodium, phosphorus, pulsatilla, sepia, and sulfur. You will recall from our previous video that all these remedies which I just mentioned appeared among the top 20 remedies. In fact, they were hedging around opium, and opium was sitting pretty right in the middle at rank 11. Among the related remedies, the Complete Repertory 2014 edition shows that opium also appears in the same list. When it comes to sensation, once again, opium is having an association or a concordance with plumbum metallicum. Importantly, plumbum follows opium well. So this could have been one of the reasons that Dr. Patil selected this, but we do not know what were the other symptoms that were supporting that judgment. Of course, in similar action also, in grade 4, opium and plumbum are very close to each other. In my opinion, it could have been a case that the patient had reported constipation and she also had incontinence of the bladder and diarrhea. So constipation alternating with diarrhea has got just about 10 remedies, and opium and plumbum metallicum are both having a strong concordance or association in that rubric as well. So we do not know for sure what prompted him to take that, but probably it was related to localities, remedies, sensations. What follows? Well, similar action and constipation, alternating with diarrhea. Let us look up some references from old masters. This is Ernest Farrington in his Clinical Materia Medica. He says plumbum suits very nicely that disease known as multiple cerebrospinal sclerosis. So this book is at least a century old, and it does mention this in the Clinical Materia Medica. It is indicated by this symptom, tremor followed by paralysis. So that's a good reference from Materia Medica by Farrington, Ernest Farrington. Here is a quote from Harvey Farrington, his son, in his excellent book Homeopathy and Homeopathic Prescribing, a book which he has written, or rather it's a collation or a collection of his lectures which he gave to allopathic MDs who wanted to start their study and practice of homeopathy. Plumbum has a twofold action upon the central and the sympathetic nervous systems. One of overactivity, including spasmodic contractions, and the other of depression of function resulting in lassitude, weakness, faintness, progressive muscular atrophy, and paralysis. So it's remarkable that plumbum addresses the two polar opposite kind of symptoms. One is that of overactivity and spasmodic contractions, and the other one is of depressed functioning, lassitude and weakness. So this could perhaps have been something that Dr. Patil has seen, these two opposites which bring together one remedy in common. Once again, Harvey Farrington from the same book which I mentioned. Plumbum produces inflammation with proliferation of connective tissue and hence is indicated in such conditions as multiple sclerosis, arteriosclerosis, and induration after inflammation. It is of service in acute affections of rapid onset and great violence, but it is equally effective in ailments which progress slowly and have a tendency to intermit. So perhaps during the follow-up periods, there has been a remission and there has been an exacerbation, and perhaps the patient has come with some acute expressions which justified plumbum. We do not know. But once again, if you see the second bullet point, it says it has got rapid onset and great violence, but also it is effective when the progress is slow, which is just the opposite of that. So plumbum is quite a picture of opposites, and this is something we can keep in our mind for the future. This is Herring, Guiding Symptoms of Our Materia Medica, which is based purely on provings. This is an excellent reference, and it goes very well with Bonninghausen's and Bonninghausen-Boger's repertory. Multiple sclerosis, tremor of right arm during voluntary motion. Arms are shaky when attempts are made to use them. Tremor of arms preceded by weakness and numbness. Tongue trembles when being protruded or when he tries to articulate. Speech is dragging and slow. So as we saw in the video which summed up the symptoms in this case, it is quite likely that Dr. Patil may have seen a trembling tongue and made a note of that. However, due to constraint of space and time, on the website he does not mention that, but it would be a good guess that probably that was one of his observations. Importantly, the speech is dragging and slow, which is of course a complaint which the patient had made. Diplopia, dimness of sight, neuritis of optic nerve. This is very important because when we saw the video of Dr. Andre Sen, he has mentioned that in cases of multiple sclerosis, the symptoms of the eye are quite important in individualizing the case and reaching the right remedy. Perhaps he was mentioning Herring's guidance, which is mentioned here. Here is a reference from Hughes, another excellent reference for provings. And as I mentioned in another lesson, this is perhaps the only book of provings which gives a chronological order of the symptoms as they appear with the patients. or the provers, sorry. Some of the symptoms of multiple cerebral sclerosis are very obvious in its pathogenesis. And mind you, Hughes is one of the best references for pathogenesis because it traces the symptoms as they appear over the course of time. He continues, and in one case observed by Renault, occurring in a worker, the ataxia characteristic of posterior spinal sclerosis was present. Now he's pointing to a particular location, but as we know from the philosophy of Bonninghausen, what applies to a locality can apply to the whole body, because by default our provings are not complete and our materia medica does not carry all the information that is contained in the provings. Here's another excellent reference from Elizabeth Wright Hubbard's beautiful book, A Brief Study Course in Homeopathy. Once again, this book was addressed to allopathic doctors and MDs who wished to take up homeopathic practice as they were not very happy with their allopathic treatments. She says, it may be said ideally, one remedy, one dose should cure, but most cases are so mixed, so confused by miasms, druggings, etc., that one must tack against the wind using more than one remedy. So I'm sure Dr. Patil must have had this in mind as well, that he had to go to the next remedy that followed well and took into consideration those observations and symptoms which he observed while examining the patient, for instance, the symptoms of speech and tongue, which could have resulted in favoring plumbum to follow the first remedy, opium 1M. Elizabeth Wright Hubbard goes on to say that some of the main complementary relationships of this type are as follows. Now, mind you, she is writing this from considerable clinical experience, and it's good to note it down in your mind or in your notebook that these are complementary relationships. Apis nat mur, quina and ferrum, and opium plumbum. So there you are. This is a very good guidance from this little book which specifically mentions this. So obviously it must be very important to have found space in that slim volume. Lippe, Adolf Lippe, was a contemporary of Hahnemann, and he was in constant correspondence, and he had considerable clinical experience, and his book of keynotes and red line symptoms of materia medica has got some real gems. So in your spare time, while the case is waiting to evolve, it's a good idea to visit that place and look up what relationships the first prescription could have to something that could follow. Something that you can do as bedside reading. Lippe on plumbum metallicum says it is especially adapted to diseases where they arise from disease of the spinal cord. And he mentions the following associations. Plumbum metallicum, complete paralysis of the urinary organs, opium. Plumbum metallicum, intellectual torpor, exactly the symptom which this patient was exhibiting. Plumbum metallicum, slow of perception. And now you'll notice that all these remedies with which there is an association, for instance, nux vomica, phosphoric acid, did appear in our initial repertorization of all the 14 symptoms taken together. And now finally, this is a copy of the report from a consulting radiologist of this particular case. And what it says is that compared to previous MRI dated 15 December 2012, the focal plaques in the brain parenchyma and upper cervical cords are no more seen. These are the same doctors who had done the previous MRI scan 4 months ago, because the earlier examination was done on 15th of December, and the second one is done after 15 months. I'm sorry, it's almost a year and a quarter. So in about a year's time, this patient has responded so beautifully, and there is no evidence even in the MRI reports. This is important to us because it gives us a time frame when we are telling the prognosis of the case to our patients. There's another video devoted to prognosis from the homeopathic perspective, and we'll talk about prognosis in that video to a greater length. To summarize what we have done in this video, we saw the follow-ups, the progress, which is reported by Dr. Patil in a very brief way, the remedy that followed, the possible reasons for having chosen plumbum, and finally, we saw the report of the MRI examination 15 months after the treatment had started. So this is one of a wonderful, beautiful cases which shows how homeopathy can work for a disease like multiple sclerosis, which allopaths admit have no cure. So thank you very much for your attention, and please proceed to participating in the forum, and I look forward to your views, your opinions, and your comments. If you have any questions, I'm sure you will be able to find them from amongst the other participants, and I will also do my best to find answers for those. Once again, thank you very much, and bye-bye.